film this.
Huh?
Are you filming this?
Yeah.
Okay.
I could stop. I could stop.
No, it's okay. Okay. So let me rewind. Last week we did the hack squad. 2 Tuesdays ago, not yesterday, 2 Tuesdays ago.
Okay.
We did the hack squad, and we haven't done the hack squad in a really long time, and we went very heavy. I felt a lot of pressure for the whole week, all the way up until yesterday.
Where'd you feel the pressure at?
My lower back.
The low back?
Like I felt like if I moved the wrong way that I was going to blow out my back again. It felt like it did right before I hurt my back.
And this was after a leg workout, huh?
Yes, this was after the hack squat leg workout.
Hack squat.
And I didn't feel it on the left side, which is where my S1 compression is. I felt it on the right side. And then, this is the sick, twisted Jen. I just said, I'm going to break my back. I'm just going to push, because sometimes I just have to tell my body to shut the F up. And now my back actually does feel better after my training with yesterday with Andy. But I also didn't do the hack squat, but we went very heavy on pendulums.
Oh, man.
Very heavy.
So it was feeling bad. It's kind of feeling better.
So now it's feeling a little bit better, but I still feel the pressure.
Still feel the pressure in that low back.
And it's a little bit on both sides now, still more on the right. My legs are very tight. I don't feel any knee pain.
Your quads are looking huge right now.
I know, because I'm up on the scale.
They're looking huge.
I know.
You're up on the scale?
Yeah.
Where are you at right now? What are you sitting at right now?
176 and change.
Damn. Uh-oh. Yeah, she can still dance and twerk, but...
I don't know.
Oh, man.
Oh, I can't twerk. Oh, my God, Miguel.
People always want to know how I break scenarios down, so I just want to do a little bit of filming and let people know how people come to the torture room, just talking real, raw shit that happens in the gyms or in life. And we got the famous Jenn Aguirre in the house.
Fix me.
And very demanding, but...
Fix me,
we'll
torture
see.
man.
We'll see how this one goes, people. Call for help. So today I really wanted to show you guys how I break things down, how I break down scenarios, how I approach each massage. And as you saw the intro, this person comes in real and raw, telling me true scenarios, things that the torture room guy gets presented with every single time. So we know it's a low back issue. We know it's a mobility issue. Where I decided to start was the muscle called the iliacus. Now this muscle is an internal hip flexor. And if you notice, while I'm working on the iliacus, I'm also doing some internal rotation of that quad. So I just want to get a little bit of movement of that muscle tissue without me really digging in there so much, since the low back is already aggravated. I like to work left to right. So I work on one side, then I work on the other for a few seconds. And what I'm trying to look for is mobility of that hip, just to get more movement in there, seeing how the muscle tissue responds under stress while I'm working on it. I like to go from the hip flexors to the quads, at least in this scenario right here. And this is just one of many scenarios, so it's not, okay, this is the way it has to be, this is the way I break it down. And so it will always change depending on how the stress level came. Is it an acute symptom or is it chronic? But I decided to go into that center quad, that rectus femoris, and then I pinned down that iliacus and tried to get more movement with the hip flexion. She actually still felt pain as soon as we started working on it with the movement there, as soon as she lifted up her knee. So knowing that she had very limited range of motion, she felt the pain in the low back. Guess what? We go back to the drawing board and we go back to the quad, try to relax that tissue up. Now, if you notice, I moved her knee up. So with that, all I wanted to do was see if I moved the leg, so passive range motion, will she still experience pain? She did not. So she only experiences pain when she moves herself. So getting back into the iliacus with the knee flexion and hip flexion and moving in and out on that thigh, just trying to get more movement. Now we're dedicating a lot of time into this quad, mostly that rectus femoris on the upper end, getting closer to the hip. As we all know, that rectus femoris does attach up to the hip, so on that inferior spine. So I really want to dedicate a lot of time to this muscle to see if we can get it to relax, to unlatch some tension on that hip. We go back to the iliacus. I ask her to move her leg up, and she's actually able to get some more flexion in here. Still a little bit of tension. We did it really slow. We don't really want to jerk this muscle movement really bad. So I decided to move into a little bit of hip movement here, passive range of motion. And what I decided to do was to release a little bit more of the low back tension is some breathing exercises, releasing that diaphragm. So as she breathes in very deep and breathes out aggressively, I'm actually flexing that hip even more while I'm pressing down on that diaphragm. This will actually help release tension off the low back. So working on a distal joint and then working on a proximal muscle, guess what? We get a little bit more movement into that hip flexion and knee flexion, and she can move it with pretty much good ease. We're about 60% better now. And to me, that's a win. As long as we get better movement, we move on to the next muscle groups. So even though it's the low back that we're mainly dealing with, guess what? I mostly like to look at assisted muscle groups and synergistic muscle groups. So here I am explaining to her why I moved from the hip to the quad and why I'm working on the inner thigh. So, and we will be starting with an attachment point called the pes answering tendon. And we all know that pes answering tendon on that inside of the knee attaches three muscle groups, which is the sartorius muscle, the gracilis muscle, and a hamstring muscle, which is the semitendinosus. And they all attach at the ASIS, the pubic bone and the sit bone. So moving up, I'm mostly going to stick with that sartorius muscle, that quad sweep in there. So I'm going really slow on this guy because I really need to figure out where it's the most stressed at. So when I can pinpoint that, then I really like to use a certain amount of pressure to alleviate that tension and get that muscle to react in a specific way that it starts to release its tension. So when I find it, I do really good trigger point work. And if you see my client on the table, she's talking to me, she's not in dire pain, you know, we're just socializing as this session goes on. I really let her know what's really happening. And that really eases the client's mind to understand the treatment. I moved into doing some gua sha on that sartorius muscle. I'm using stone because it doesn't traumatize the muscle. And you might be thinking, well, if you're working on the sartorius muscle, why use a stone that's not going to traumatize it? We're looking to release fascia. And guess what? That movement there, nice, smooth, easy. As long as she can move, she has room to improve. And that's amazing. That's always going to be a win in my book. And what we're looking for is mobility. So here we're moving into that diaphragm again with the low back issue and how it came about. So each one is going to be different. Everybody gets low back issues depending on the activity that we're doing. This was a specific exercise. So this is why I decided to break the session down and just let people know what's going on in my mind, what's going on in the torture room guy's mind. So from muscle to joint, and why I'm going from one muscle to the next. And here I just wanted to relax that diaphragm and get more of that low back to release. Next, we're moving on to the feet. And I just really want to get onto that plantaris muscle. That plantaris muscle does have two heads. So it kind of looks like a web a little bit right on the bottom portion of the foot, and then the second head attaches on the back of the armpit of the knee, so on the outside. So knowing when there's ankle flexion and knee flexion, that plantaris muscle gets put under a lot of stress. Just wanted to relax that. Once we got all that anterior side done, we got that mobility opened up, we got that muscle tissue just nice and relaxed. We're turning her over and working on the posterior chain. Right, now we're now that we got her turned over, we're going to start the posterior side. If you've stayed along this far, I hope you guys are liking how I'm breaking down this session. I hope to bring out more of these. This is mostly for the LMTs that follow me on social media and on my YouTube channel. So LMTs, licensed massage therapists, people are always asking me how I'm breaking scenarios down, how I create a session from beginning to end. How do I know exactly what I'm deciding to do? So, and if you noticed, even though this was a low back issue, we haven't even touched the low back yet. We're working on all those assisted muscle groups, active muscle groups that made that movement cause this low back tension, and the muscle groups that stabilize the joints. So here we started off with the adductors. And again, we work from left side to right side. And then after that, we're gonna just start to relax the glutes, mostly that glute med, but we do end up going a little bit into that piriformis muscle. I like to flex that knee and bring in some leg rotation while I'm working on the glutes, especially that glute med. That glute med does have a small attachment fibers that go up to the front of the hips, so it's really gonna help bring that tension off those hip flexors. So as this athlete here decides to go back into the gym and do all these compound movements, there's gonna be less tension put on that low back. So again, I like to go from left side to right side. I don't just like to work from one side in its full entirety and then go to the next. I like the body to actually respond from both left side to right side at the exact same time. That way the body's not getting tricked into thinking one side is getting all the attention and one side isn't. Once we relaxed everything from the adductors to the glute med, we're going to get into that low back. If you see, I started off with a scraping tool here, and I decided to go with the metal tool just because we're going to start, this is done pretty lightly, we're going to start on that aponeurosis tissue on that low back, that connective tissue. It's a very thick sheet of connective tissue. So I want to relax that. And a lot of people have seen me do this before and always ask me, like, why do you always start the low back like this? Well, it is covered with that thick connective tissue. So what I want to do is just kind of release tension off this connective tissue with the scraping tool. And that will help me, at least this is all through the power of touch here. It allows me to read what is happening to the muscle tissue from all the lumbar vertebrae going into that SI joint, into the lower rib cage, that transverse abdominis. We're looking at all these. So it just helps me read the tissue of what's going on. So it exposes the stress level of what's really happening underneath the fascia and all that deep, thick connective tissue. And then I move to some cross fiber friction, and we are working on the transverse abdominis primarily. And everybody knows that transverse abdominis kind of wraps around, kind of like a waist belt. It wraps around and attaches all the way into that front, into the inguinal ligament. Once we got that kind of relaxed and moved around, then I'm going to start with some trigger point work right on the paraspinal muscles. I love to work right along the spine. I know it's a very tricky area for a lot of massage therapists, especially when they're kind of new. You really don't know if it's too much pressure, like how do you approach it? Trigger point therapy for me has always been helpful in my career, and we're just going right up the paraspinal muscles, starting with the closest to the spine and then just working our way outward. But once I relax those paraspinal muscles, then I'm really only staying on the low back. We will be moving into that QL here in a minute, but I like to dedicate time to the paraspinal muscles though. And again, going left side to right side, back and forth. This allows me to get a good read of what's happening to the body. And again, I do this because I believe that the body gets a simulation that it is getting worked on both sides and it's healing on both sides, not just one side and the client walks out of the room feeling like one side's good and one side isn't. Again, we always got to look at the client, and this person is an athlete and does a lot of compound movements in the gym, so proprioceptive action really needs to be correct. Moving into the QL, this trigger point work that I'm doing here is like a push-pull movement. I learned this from a colleague of mine. It's very effective and can be used in just about any muscle group. But I'm pushing in from the outside of the QL, going in towards the spine, and then I'm pushing it right back out. And this really gets a good reaction of the muscle tissue, especially this QL, to get it to like relax really, really quick. The sticky areas, and we all know those sticky areas where it's hard, it feels like it's knotted. I like to do some trigger point work on those, get some flexion of the knee and some rotation, and guess what? That muscle tissue just starts to respond to everything that you're telling it what it needs to do, so it doesn't latch onto the joint so tight to where the person can continue doing whatever it is that they want to do in life, whether it's weight training, whether it's just going through their day-to-day life, or even if them being active is just being able to go walk around the park. That low back takes on a lot of tension, a lot of pressure, and it carries on a lot of that load-bearing movement. So here again, doing some trigger point on that QL, flexing the knee, getting some external rotation of the hip, and that's really going to give me a read on that muscle fiber. So I'm trying to move that muscle fiber with movement of the leg, while I'm staying right on it with some trigger point work, instead of me just doing so much manual tissue on there. We let the joints do some of the work as well. Then we're going to end it up with a little bit of effleurage on both sides. This will really just help relax a lot of that tissue, plus it will help move that lymph, all that stagnation that stays there. When muscles get too stressed out, the lymph is also going to get stagnant, and nobody wants that, nor does the client. So that's how we did it today, people.
Whenever you're ready.
All right, checking in. So.
Yeah. Can you twerk?
Yep,
Oh, damn.
I win.
There we go.
Okay, so he fixed me up, /fucked me up, /fixed me up. So I feel good. Back feels good. There were a lot of movements that we did, and then they were not moving very well, and then he did his magic. That's why I call him Magic Hands. Is that how they do Magic Hands? I don't know, whatever. But I'm all fixed. Thanks, Miguel.
There we go.